That cannot be good. Hey guys, it's Matt the Bowtie Guy. Today's topic, something that everybody does, but nobody wants to talk about. Poop. Yes, that's right. Stool, feces, dung, crap. I know, it's a pretty childish topic, but it's really important to us in the medical field. It can really tell us a lot of information about your overall health, not just your bowel health. So, let's get to it. Today's topic, we're really going to explore what's going to happen when you see something in the toilet that might surprise you. Whether it's blood in your stool, blood after wiping, if your stool is small and hard, or if it's really loose. There's always something that it's trying to tell you, and my job is to clear that up for you, when you really should be alarmed, when you should give it some thought, and when not to worry. Always look for the red flags. And what I mean by that are things that really should grab your attention right away and make you call your primary care provider instantly. And that's really blood in your stool. If you see bright red blood in your stool, if you have any bleeding from the rectal area, you really want to call your primary care doctor right away. It could simply be just some hemorrhoids. Those can cause some bright red blood, especially after wiping. You might have a little itching, a little rectal discomfort, but you don't want to mess around because blood can be a sign of cancer. Not to scare anyone, but it's something that's important that you really should bring up to your primary care provider, and pretty quickly at that. Another point about finding blood in your stool is if you're on a blood thinner, if you're taking any type of non-steroidal anti-inflammatory chronically, like ibuprofen, Aleve, diclofenac, naproxen, naproxen, all of those types of medications, or even aspirin, if you see a lot of blood in the toilet, you really should call your primary care provider because those put you at an increased risk of bleeding, and that could lead to a serious anemia or maybe the sign of an underlying issue that needs to be addressed immediately. The other sign of blood in your stool, believe it or not, is if your stool looks like black coffee grounds. I know it sounds strange to see, but if you look in the toilet bowl and your stool is black, I would certainly call your primary care office right away. That could be a sign of a bleeding higher up in your intestines or in your stomach, like an ulcer. What happens is, as the blood passes through your digestive tract from higher up in your system, it actually oxidizes. That bright red blood and the iron, once it becomes in contact with your digestive fluids, the acid, things like that, it starts to turn black. So if you see black coffee ground-like stool in the toilet bowl, your alarm should go off immediately. Call your primary care provider right away and get seen and checked out immediately. Probably sometimes, this is rare, but it can be caused by Pepto-Bismol and some other medications that your primary care might prescribe you, but I would certainly give them a call just to be on the safe side. It's something very serious that you don't want to mess around with, and if you catch it early, it can be treated fairly simply. If you let it go, that may land you in the hospital with a pretty serious illness. So definitely call your primary care, guys, if you see any bright red blood of any kind, or if you see black coffee grounds in the toilet bowl. Alright guys, so constipation. I know it's an awkward topic, but everyone has experienced at least one point or another in their life. Now, a lot of people ask me, what's normal for how often I should be moving my bowels, going to the bathroom? Well, in all honesty, your normal might be different from my normal or someone else's normal. It can range anywhere from 4 times a day to twice a week to every other day. It really doesn't matter as long as it's your normal and you're not having any discomfort, you don't feel like you're not emptying your bowels properly or evacuating your bowels properly. That's what matters. So everyone is different. Don't freak out if you move your bowels every 3 or 4 days. If that's what's comfortable for you, that's what you've been doing your whole life, don't be concerned. Now, constipation, what is it? Constipation can be considered either moving your bowels less frequently than you normally do. So if you move your bowels at least once or twice a day, and then all of a sudden you're only going to the bathroom every 2 or 3 days or every 4 days, that's constipation. The other aspect is if it's hard to go, the stool itself is hard or small, and you feel like you didn't properly empty out your bowel, that's constipation as well. There's so many different causes, traveling to a different place, dietary changes, so increasing the amount of dairy or cheese that you eat, rice, if you increase your red meat intake, you eat a low fiber diet, it's going to bind you up, almost like cement inside of your intestines, and it's going to slow things up, and then you're going to be constipated from it. The other cause might be some medications. Some people who are on chronic pain medicine such as Vicodin, Percocet, Tramadol, Oxycodone, Methadone, Fentanyl, all those horrible things you hear about in the news that are used to help some people who are in some serious pain. It can be called opioid-induced constipation. It's a real problem. So if you're on those medications and you notice, hey, my bowels have been a little bit slower than usual, or it's a little harder to go, or my stools are looking small and hard, then I would certainly talk to your primary care provider about that and make sure that that's addressed, because those medications are notoriously guilty of causing significant constipation. So there are a lot of ways to help that, and there's new medications in the market that can counteract the effects of those narcotics. Even though that's kind of chasing one medication with another for side effects, it actually is worth it in the long run. It'll give you a lot of comfort, especially if you're already in chronic pain as it is. The other cause of constipation that's very frequent is irritable bowel syndrome. A lot of people are afflicted with this disease. There's all different types of irritable bowel syndrome, but there's one type called irritable bowel syndrome with constipation. And what that is your intestines and your mind are usually deeply connected and coincide with one another. If you have irritable bowel syndrome, that nervous system is a little messed up. Your bowel gets nervous, so when you're anxious, you're stressed, you're under extreme circumstances, you're ill, your bowel's not going to function the way it normally should, and boom, you're constipated. It gets spastic, it slows down, the intestines aren't moving as much as they normally should be, you're losing water from that stool, the stool's not moving as quickly out, so it starts to harden, as if you're mixing cement and you stop turning that spoon. It's something that really can be painful. It can be uncomfortable. It can cause cramping and bloating. It's a pretty nasty illness that a lot of people are afflicted with. So if you have irritable bowel syndrome and constipation, that's something that can be treated similarly to other ways of being constipated, but it's something that may need to be looked into a little bit more just to make sure there's nothing else going on. Now, how to fix constipation. It's actually pretty easy in a lot of cases. Mostly all you have to do is, if you're not drinking enough water, increase the amount of water you're drinking. If you add water to your system, it's going to soften the stool. You have more water for your intestines to soften it, to pass it through. You have more formed stools. They're not hard and small, and it's a little bit easier to move your bowels. Your body has every possible motivation to hold on to water and use it for as many different things as possible. And so if you're not drinking enough water, your body's going to use it for the more important things, like your blood, your vital organs, and it's going to actually take it away from your intestines, because it's not that crucial that there's a lot of water there. You really need it to more so filter your kidneys, your spleen, your liver, use it for your heart, your lungs, your brain, your eyes, things like that. So it tends to pull that water out of your GI tract first, because it's not crucial, it's not essential. So if you drink more water, it'll help nourish and hydrate all those other organ systems, so then it says, oh, I got plenty of this. Let me put it back in the intestines, it softens the stool, and you're back to normal. So definitely increase your water intake. The other way to help get your bowels moving is to increase your dietary fiber. Eat more greens, eat more vegetables, eat more fruits, eat more nuts, things that have a lot of fiber. Fruits that have a lot of fiber are typically berries, pears, plums, apples, things like that. Melons, pineapple, bananas, grapes, they have very low counts of fiber, and so they may not be as helpful when you're constipated. I would focus more on berries, pears, apples, plums, things like that. I'm sure you've heard prune juice. Everyone hears prune juice. Everyone's always like, oh, why do old people always drink prune juice? Well, it's not just old people, it's a lot of people who drink prune juice. Personally, I love prune juice, it tastes delicious, or even dried prunes, but it helps move the bowels because there's so much fiber in it. So that's why sometimes you might hear of old people liking prune juice and always eating prunes. It's because it helps with their bowels. As you get older, the bowels slow down, and so prunes can help with that. Now, the other way you can get your bowels moving is by moving. It's simple, it's plain. Exercise. When you move, your intestines start to move. Think of your intestines as like a pastry bag that goes like this, and like this, and like this, and like this. It's squeezing the stool down. If you're not moving, it's very lazy, and so it doesn't squeeze that stool down and out. And so if you start to exercise, your bowels will liven up and they'll actually move better. And so this way your bowel movements will be more frequent and they'll get the stool out faster, meaning you have less time for water to be sucked out of that stool and to have harder, more difficult stools. So definitely get moving. Even simple exercise, walking, some chair exercises if you have problems with ambulation, in other words walking, those can certainly help and get things moving better. So you've increased your water, you started exercising, and you've increased your dietary fiber, but you still can't go as well as you should. What do you do next? There's a lot of over-the-counter products that you can use. First, I would start with fiber supplements. That would be Metamucil or Benefiber. There's tons of them out there. They're all pretty effective. They're all fairly natural for the most part. Most of them you just add a tablespoon or a teaspoon, depending on which product it is, to a glass of water, a glass of juice, things like that. It adds more fiber, pulls more water into your stool, bulks it up, and allows it to move more freely out of your intestine. So this way it's looser, it's formed, and it's easier to go. So give that a shot. Some people who have irritable bowel syndrome or some other bowel disorders, you may want to avoid that because sometimes it can actually make your symptoms worse. So I would certainly speak with your primary care provider first before trying those fiber supplements. What else can you do? There's also stool softeners over the counter. Stool softeners are pretty benign for the most part. They allow your stool to be a little bit softer, help with the passage of stool a little more easily. Sometimes it's all most people need if those other lifestyle or behavioral changes don't work first. So you can certainly try some stool softeners over the counter. They're safe for any age for the most part, as well as most medications and health conditions. Just double check with your local pharmacist or your primary care provider before you start anything if you're that concerned. Usually they are pretty benign. Now, laxative. This is a very hot topic for a lot of patients. They always want to try doing things on their own, which is commendable. You don't want to bother your primary care, or you feel like you don't have the time or you don't have the money to spend on the copay, so you're wanting to go to the pharmacy and try something else. So you can certainly call your primary care office and see if they recommend anything after you fail those first few things I've recommended. And if they kind of are a little hesitant to tell you what to get, talk to the pharmacist. They know your medications, and they're pretty good at teasing out what's safe, what's not. But for the most part, I would get the guidance of a healthcare provider of some kind, because a lot of laxatives can be dangerous for a lot of different folks for multiple reasons. So be very cautious. It can also mess up your intestines. You can become dependent on them, and it can really ruin the pattern of your bowel movement. So be very cautious when it comes to that. So you have constipation. What shouldn't you do? First of all, you shouldn't just sit there, eat bananas, eat cheese, eat red meat, and not drink water. Do all those things we talked about. But another thing you should really try and avoid doing is straining while you're trying to move your bowels. What straining does is it puts unnecessary pressure on the rectal area, which can cause hemorrhoids. For those of you who've had them, yes, they're horrible. I get it. I've seen some horrible cases of hemorrhoids. They are a nuisance. If they thrombose, they can be extraordinarily painful, and a lot of times to get rid of a thrombosed hemorrhoid requires surgical intervention, and it is not a pleasant experience. So I would recommend avoid straining and do what you can to fix the constipation before it gets to that point. Hemorrhoids, typically, you have a little bit of bright red blood on the toilet paper after wiping. You will have some rectal itching, some rectal pressure, and typically it's associated with prolonged sitting, prolonged standing, or if you've been straining with constipation. So if you have any of those symptoms and you're really concerned, I would certainly recommend calling your primary care and getting checked out. I know it's embarrassing to have someone look at your butt. Who cares? Your health is way more important than some silly little self-conscious moment that's very fleeting. It'll pass, I promise you. Now, what should you look out for when you're constipated as a red flag symptom? If you experience pain, bloating, or nausea at any point after being constipated or while you're constipated, I would call your primary care provider right away. If you're not passing gas, yes, if you're not farting, cue the stupid noise, then I would call your primary care provider. That sometimes can mean that you're so constipated, your stool has turned into a cement ball, it's blocking your intestine, and you may have a bowel obstruction. That's a surgical emergency, and it can be very serious. Sometimes you can actually perforate or rupture your intestines, and that's a very serious medical emergency. So prevent it from happening. If you have these signs, just get checked out. That's the best bet. It's better to be safe than sorry, right? Your constipation's gone, you're feeling great, time goes by, all of a sudden you get the gurgles, you gotta go to the bathroom, you have diarrhea. Everyone has been there. From a baby to the elderly, everyone gets diarrhea, and this is a very serious problem. The reason why us medical providers get so worried about diarrhea is, first of all, it means something's not right. You shouldn't be having diarrhea. If you do have diarrhea and it lasts long enough, especially if certain health conditions, you take certain medications, you're a certain age, like really, really young as a child, or you're really, really old as an elderly geriatric patient, then you can get very dehydrated, and that can lead to some horrible conditions, especially something called metabolic acidosis, or sometimes even kidney failure, because you're that dehydrated, you're losing a lot of electrolytes, and the diarrhea is just literally your water coming out of your body. So diarrhea is something very serious. It's actually one of the leading causes of death amongst children across the world. That is improving as we get cleaner water and vaccines are distributed evenly amongst international and developing countries. But it's a big problem. So we've all been there, and it's something to take seriously. So diarrhea, what is it? So diarrhea is a looser consistency of stool with urgency sometimes, or with increased frequency. So if you normally move your bowel once a day and you've had to go to the bathroom 8 times a day, you're probably experiencing diarrhea, or at least a looser stool. So what can cause diarrhea? Diarrhea, yes, diarrhea. I know, childish, diarrhea, cha-cha-cha. So, diarrhea is something that can be caused by numbers of different things. It can be caused by illness, food poisoning, viral stomach bug. It can be caused by irritable bowel syndrome. Yes, just like with constipation, there's irritable bowel syndrome with diarrhea. Inflammatory bowel disease like Crohn's or ulcerative colitis. It can be caused by celiac disease. It can be caused by dairy fat intolerance. It can be caused by lactose intolerance. Multiple different health conditions can cause diarrhea. Certain medications, that can cause diarrhea as well. So make sure you're aware of what you're taking, especially if you start a new medication. That might be it as well. The other thing too that can cause diarrhea is certain foods, a lot of greasy or spicy foods that can upset your stomach. If you went a little too much overboard with alcohol at a family event or a party or friend's house, things like that, that can cause diarrhea as well. But all these things can contribute to diarrhea. So try and take note of your surroundings, what's happened the past few days, your diet, your medications, your exposures, things like that, just to help tease out, what may have caused this. Use your best judgment. If you have diarrhea and it's lasting for more than 24 hours, if you have diarrhea and you have a fever and chills, if you have nausea and vomiting, if you have abdominal pain, and especially if you have blood in your stool, I would call your primary care provider immediately without hesitation. Do not mess around. Those are signs of something that's more serious that could be going on. It could require an antibiotic, it may require hospitalization, or sometimes even just IV fluids to help replete in your body what you've already lost. So why is diarrhea so dangerous? When you have diarrhea, you're losing a lot of water frequently. A lot of people call it peeing out your backside. Well, sometimes, yeah, that can happen. I would be very cautious. If you have diarrhea, take it seriously, especially if you're over the age of 65, if you have certain health conditions, or if you're under the age of 18. Those all put you at risk of serious outcomes, just to be on the safe side. Now, how do you treat diarrhea? Well, it depends on what's causing it. If it's a stomach bug, just make sure you increase your fluids with electrolytes. So watered down Gatorade, some coconut water, sometimes Pedialyte, things like that, popsicles, broth, just to get some liquids in. If you have diarrhea, I would avoid dairy. Dairy can really upset the bowel, especially if it's already irritated, and that can make diarrhea worse. If you've been on an antibiotic recently, that's something you really should have evaluated. Antibiotics are associated with diarrhea. Sometimes it can just simply be that you killed off the good bacteria in your intestine. It's trying to figure out what to do, so it's trying to expel some bad bacteria. But if you have diarrhea after an antibiotic and it's not getting better after you finish the antibiotic, get checked out. It could be something called Clostridium difficile or something called C. diff colitis. It is a horrible diarrheal illness that is very difficult to treat. And it really requires attention immediately. It can be very serious if it's left untreated. So you've had diarrhea, you've increased your fluids with electrolytes, then what? If it's pretty mild, you're not having any belly pain, fever, chills, things like that, try increasing foods like bananas, rice, having some applesauce, some toast. It's what's called the BRAT diet, B-R-A-T. And that basically is bananas, rice, applesauce, and toast. It's cement. It's glue for your colon. And what it's going to do is it's going to help bind up. They're very low fiber foods, so it's going to bind up that stool and help slow it down so that the water can be pulled back in your system and the stool cannot move as frequently as it is. And this way it'll slow down the bowels. It'll help thicken that stool so you're not having loose stools. So try the BRAT diet. The other thing too is remove the offending agent. If you're eating a lot of fatty foods and you feel like that's what's triggering it, if you eat cheese or ice cream and that's what's triggering it, get rid of it. If you notice that if you eat a lot of foods containing gluten, so breads, beer, pastries, anything that contains pasta, anything that contains wheat, barley, or rye, you may want to get tested for celiac disease. A lot of times this is accompanied by belly pain, weight loss, and blood in your stool. Sometimes fever, joint pain, rashes, things like that. Everyone's on this whole idea of, gluten sensitivity, things like that. Jury's out whether or not you can be gluten sensitive. But if you notice that your symptoms are worse with gluten, I would certainly call your primary care, get some blood testing done. You may need an endoscopy or colonoscopy for biopsies, but it's something serious that should be checked out. If it goes untreated, it can lead to an increased risk of colon cancer, so definitely get that figured out. You've had diarrhea now for a couple days, it's not getting better, you've increased your fluids, you're feeling worse, what to do? Obviously, you know what I'm going to say. Call your primary care provider. And the reason I say this is there's probably something else going on here. You may be dehydrated. You may have some electrolyte disturbances. Your sodium might be low. Your potassium might be low. Things like that. So definitely get checked out. The other thing too is if that symptom is persisting, you may need to have some sort of belly imaging, whether it's a CAT scan. You may need to actually do some stool studies, so a stool culture. If you've been traveling abroad to a tropical area or a foreign country, sometimes it's rare, but you can develop parasites, and stool studies can check for eggs and parasites and infections, and this way they can be treated pretty easily. Primary care provider, they ask you, so how have your bowels been moving? You can answer that to the best of your ability, and when they ask you what it looks like, some people say, well, sometimes it looks like little rabbit pellets, or, sometimes it looks like a big pile of mush, or some people say, oh, it's, little longs, or, it could be ribbons, it can look like thin little pencils. The best way to explain to your doctor is something called the Bristol stool chart, seen here. Now, what I would do is ask them to pull it up. If you have a smartphone, you can pull it up on your phone and just point to it. That's the easiest way for your provider to get an explanation of what your stool looks like. It can tell us so much about what's going on in your body and give us a better line of questioning so we can figure out what's going on with you. So don't be afraid to show your doctor, your nurse practitioner, your physician's assistant, whatever your stool looks like. It's so important. All right, so let's recap as to what we talked about. I know we covered a lot, and we could definitely talk a lot more about some stuff, literally. But I think it's really important to understand why your stool looks the way it does and why you're feeling the way you do. It can be a bigger sign of your overall health, not just your bowel health. So if you have constipation, you're moving your bowels less frequently, it's harder to go, the stool is a little bit harder or it's smaller than it normally is, that's the sign of constipation. How to fix it? Increase your fluids, water especially, increase your dietary fiber, fruits, vegetables, nuts, and get some exercise. Start moving and help move things out. If you're not moving after doing all those things, try a stool softener over the counter. If that doesn't work, call your primary care provider or ask your local pharmacist what you can do to better get your bowels moving. That's how you treat constipation. Now, if you're constipated and you have belly pain, if you're bloated, if you're not passing gas, yes, again, and if you're noticing that you're having any nausea or if you've been vomiting at all, call your primary care or go to your local emergency room. You could have a bowel obstruction. It's a very serious condition. Diarrhea. So diarrhea, like I said, can be a very serious problem. It's not normal to have diarrhea, so I would get checked out if it's something that's persisting, it's been an issue for you, or it's non-stop. So diarrhea, the best way to manage it, increase your fluids with electrolytes. Sometimes by drinking just plain water, you can actually make the problem worse, because when you have diarrhea, you're losing your sodium, your potassium, all of your electrolytes. If you do something like watered down Gatorade, Pedialyte, coconut water, that's better. It'll help get those other electrolytes and nutrients into your system that you're losing, so this way you're not watering down your system. You're still having diarrhea, you've increased your fluids, what else can you do? So I would certainly recommend doing what's called the brat diet. So bananas, rice, applesauce, and toast. Those are going to glue up the stool in your colon and help bind you so that you're not having that loose, watery stool. If you've been on an antibiotic recently and you stopped it and then you develop diarrhea, or the diarrhea gets worse after you finish the antibiotic, call your provider. You have to. It's a very serious emergency called C. diff colitis, very difficult to treat. Now, that sums it up. Constipation, diarrhea, blood in your stool. If you have bright red blood, if you have pain with it, if you've had diarrhea with it, if you have fever, chills, you're on a blood thinner, you need to be evaluated immediately. Anything I say in these videos, always run it by your primary care provider. They know you best. I don't know your health conditions. I don't know what medications you're taking. I don't know your circumstances. I can't examine you. I can't look at you. So I would always recommend that you get checked out by your primary care, because they know you best. So there you have it, guys. This is easy. All you have to do is keep an eye on your stool. Until next time, guys, I'm Matt the Bow Tie Guy. See you later.